we are going to get started. Hi everyone. Welcome to our May Environmental Health Seminar Series. My name is Tina Chen, and I'm an Environmental Health and Science Knowledge Translation Scientist at the NCCEH. So just a few housekeeping items before we start. For those of you on the phone attending as a group, if you would like to receive sci-fi educational credits, please email me. I will put my email address in the chat box online so that I can mark you as present. During the question and answer sessions after the presentation, if you could enter your questions into the chat box, we'll answer your questions verbally accordingly. So today we're very excited to have Dr. Peter Berry, who is a Senior Policy Analyst at Health Canada, to present about his work on climate change in Canada. So just a brief bio for Dr. Peter Berry. Since arriving at Health Canada in 1999, Dr. Peter Berry has conducted research in several areas related to climate change, including health risks to Canadians, adaptive capacity, health vulnerability assessment, and communicating climate change risks to the public. He is currently a Senior Policy Analyst and Science Advisor to the Director at the Climate Change and Innovation Bureau at Health Canada. So thank you, Peter, and now over to you.
Well, wonderful. Thanks so much, Tina, for organizing the session. Thanks for the invitation. Thanks to Lydia for the invitation, and to the National Collaborating Center on Environmental Health. It's a real pleasure to be discussing climate change and health issues through the seminar series. It's really timely given the increased interest and the concern about impacts on Canadians. And so in our office at Health Canada, the Climate Change and Innovation Bureau, we're currently engaging many partners on a number of key initiatives. So I'm going to speak to a number of these in my presentation, including our National Climate Change and Health Assessment. So there's a really great opportunity to raise awareness about some of the initiatives, but also to invite input and I guess partnerships moving forward. And so I've got all my contact information on the last slide of the presentation. So I really invite people in terms of follow-up. So very excited to be presenting today. So next slide, please. So some of this people will already be aware of, but I'll just chat a little bit about some of the information about how our climate is changing very briefly. Some of the new information that people might not be aware of in terms of climate change risk to health. How a number of health authorities across Canada, from the local to national level, are preparing for climate change. And then some information on activities at Health Canada in partnership with others. Next slide, please. And actually, we can flip to the next slide, which shows the evidence of climate change that warming is unequivocal. So this is a figure, again, people will be aware of this. The globe is warming very rapidly. It is a little bit dated. It's showing that 2016 was the hottest year on record, but we know that 2018, 2019 are ranked quite high. 9 of the 10 warmest years on record have occurred since 2005. And the pace of warming is actually increasing, which we'll see from a health perspective is concerning. In fact, I think it was in 2016, the first 6 or 7 months individually were record warming months. So it's really rapid warming that we're seeing around the globe. And next slide. And people will recall from the release of Canada's Changing Climate Report from Environment and Climate Change Canada. Canada is actually warming faster than other countries, about twice as fast. So the globe is roughly warmed at about 1 degree. On average, Canada is warmed at about twice that. And in the north, we're seeing a very significant warming, about 2.5 degrees. And so that's having very observed impacts right now on populations living in the north, including on health. And so we'll see a bit more about that. And then on the next slide, we see we can continue. We're going to continue to see warming into the future, and this is actually from that recent report. And you'll notice that there are the two scenarios. the RCP 2.6 scenario, which is if we take very aggressive actions to reduce greenhouse gases, and the high emission scenario, RCP 8.5. And so we're looking in Canada at between 2 and 7 degrees Celsius in terms of the variance. But really looking at around 4 or 5 degrees, and this is average temperatures. So some of the extremes will be more severe with that warming. Next slide, please. And then we can go on to the next slide. And so a number of people have heard in terms of, well, what does this warming mean for health? The World Health Organization's indicated that, climate change is going to be the greatest threat to health in the next, during the century. But they've also indicated that it's going to be a defining issue for health systems in the 21st century, which I think should concern us all, given that many of us are working in this area. And health systems are really the first and last line of defense for protecting Canadians from climate change. The first in terms of the preventative measures that they can take with respect to preparing for climate change, reducing even greenhouse gas emissions, and of course the last line of defense in terms of treating people when needed from the impacts of climate hazards. So we really need to understand some of the impacts on health to really prepare some of these health systems. So the next slide provides an overview in terms of recent results from the IPCC, the Intergovernmental Panel on Climate Change 2014 report. And we've got a lot of confidence that health risks and health impacts, and this is globally, are going to increase in terms of heat waves and forest fires, those related to reduced labor productivity, undernutrition, foodborne diseases, waterborne diseases, and vector-borne diseases. And so you'll note that there's either very high confidence, meaning 9 chances out of 10, or high confidence along most of these. So we know what to expect from a health perspective, certainly on the global scale. And then in terms of the next slide, this is a figure from the Lancet Commission report on climate and health in 2015, and it just provides information on the pathways through which climate change can impact health. And so a lot of people will be familiar with, the direct impacts and the indirect effects in terms of some of the things that I just mentioned. I think what I think is really quite important in terms of planning forward about how we might adapt is recognizing the importance of social dynamics on whether or not we'll see and to what extent we'll see health outcomes. So things like the age and gender in your jurisdictions, social capital, the public health infrastructure, these kinds of factors are very, very important in terms of whether or not populations will be significantly impacted from the kinds of hazards that we'll talk about. And these are the kinds of things that as we move forward with, local or regional or national assessments, that they need to be included in that kind of analysis as well, because they can be really determining factors on the extent of health outcomes that we might see. So, in terms of specific health outcomes, if we go to the next slide, we actually have some new and recently released reports that can be very, very helpful. And so I just want to draw your attention to the recent report, the Canada Communicable Disease report. And there's actually a couple of additions on climate change impacts on vector-borne diseases. And this particular one is edited by Nick Ogden from the Public Health Agency of Canada. And this provides some of the latest information about the potential increased risks of exotic infectious diseases in Canada. Possible spread northward of diseases, things like Lyme disease from the United States, and even the reemergence of vector-borne diseases, things like West Nile virus, where you may get more breakouts in terms or outbreaks in terms of that disease. So we're actually really quite lucky too to have Nick as a lead author for the infectious disease chapter of the National Assessment that I'll speak to you about a little bit later. But that's some very helpful, I think, recent research that could be of interest to everybody. And just on the next slide, we are seeing these kinds of impacts in Canada. This is just at the top showing the number of reported cases of Lyme disease, and people will be very familiar that we are seeing very significant and rapid increases in a number of communities in Canada. And so I know colleagues at the Public Health Agency of Canada are doing a lot of work on how do we best adapt to that. So on the next slide, you'll see that we're also quite concerned, and we're concerned right now about wildfires and fire disasters in Canada. We know that the number of fires has actually doubled since 1970. And these pose a number of very significant risks to human health. One slide that I don't have here, but I've had in previous presentations, is just showing the very catastrophic wildfires that we've seen in the past. And you don't have to go back very far in terms of only 5 or 6 years where you've got multiple fires, and so these are a significant concern from a health perspective, and being related to climate change. And this slide actually just shows that some health systems can be significantly impacted. We're starting to see more evidence of that. And so the wildfires in 2017 in BC that affected 19 health facilities, had many patients actually evacuated, and also affected a number of health services staff. So this is something that we need to really be looking at and getting more information about through things like vulnerability assessments. The next slide shows, where this is something that our office is working on quite a bit with a number of partners across Canada. The issue of extreme heat and health. And just reminding people that distinct and individual heat waves can have very significant impacts on communities and can cause a number of deaths. And people will likely be familiar with the recent report of 66 deaths from the Montreal heat wave in June, late June and July in 2018. And, the fact that specific populations were at much more risk during that heat wave, people suffering from chronic illness, older people, and people with mental illness. And so really important to think about how best can we tailor some of our interventions to some of those vulnerable populations. So the next slide, this is from a colleague in our office, Malik, and looking at what we can expect in the future in terms of heat events that can affect health. And a number of communities are projected to experience many more of these as the decades, in future decades. And these are heat events at about 30 degrees Celsius, so they're within the range that we know can impact health, can cause increased deaths. And so there's a high amount of certainty. And in fact, Environment and Climate Change Canada's report has indicated that we're observing this increase in hot days. So we can expect more, and we need to prepare more for these. But, a new area of, I think, concern, and in fact research, in the next slide, is the mental health impacts of climate change. And so this just provides one example of one hazard, the flooding in Manitoba in 2011, very severe flood, and some of the observed impacts on mental health that were associated with that flood. Things like increases in alcohol and drug use, family violence, depression, anxiety, sleep disruption. And research since that time, suggests that things like even extreme heat events can increase some mental health impacts. For example, aggression. There's a number of different hazards that we're seeing can affect mental health. And there's also the growing concern around the kind of a general impact, something like eco anxiety, where people realizing the severity of climate change are being impacted in terms of their mental health, and that's a big concern moving forward. Next slide. Again, another area of interest, I think, for health authorities, and something that we do need more research on is climate change and occupational health. And I know some colleagues in Quebec are looking at heat and occupational health, and we'll learn a lot from that project. But this particular paper highlighted a number of areas in which climate change could affect the health of workers, their productivity, their health directly. And so you can see significant economic links here in terms of those impacts as they increase, and if we're not addressing them through appropriate adaptation. So, impacts from increased air pollution, extreme weather, wildland fires, changes in the built environment, vector-borne diseases. There are a number of areas where workers outdoors, but also perhaps indoors in hot environments, can be impacted. So, something that we need to learn more about. And then the next slide just highlights, and I think people will be familiar with this, that there are a number of populations that are at higher risk from climate change impacts on health. Infants and children, pregnant women, seniors, people with perhaps chronic medical conditions, Indigenous people, people that are maybe impoverished or of low socioeconomic status, outdoor workers. But I also wanted to highlight that there's new and recent evidence about first responders, police and healthcare and social services workers can be very significantly impacted from some of these hazards, particularly as they get more severe, and as people that are on the ground responding to some of these hazards, trying to reduce impacts on Canadians. We need to be really cognizant of that and be thinking about how best to adapt in that regard. And then the next slide, I think reminding people that one of the things that climate change is doing and will continue to do is increasing the probability of cascading events or more complex disasters. And that's a significant concern because they can be difficult to plan for, and we need to figure out the best ways to plan for these. So this is in 2011, some of the wildfires and floods in Slave Lake that sort of happened concurrently as an example. But in Ottawa, we've seen floods and tornadoes in the span of a couple of years, and so these are increasing risks to health because they can affect the capacity of health systems and health workers to adapt, and of Canadians to cope with these things. So the next slide just provides a bit of a summation in terms of some of the things that we've observed with respect to impacts on health. I've mentioned a number of these, but we see that they're across Canada. There are common issues across Canada, but certainly between north and south, there are some very significant differences. And we know that in many northern and Indigenous communities, there are very significant concerns around food security and climate change as the climate continues to warm and traditional foods are impacted. So there can be some significant differences between regions, but we can learn from each other moving forward when we conduct assessments and when we plan our adaptations, and we'll need to do that increasingly as we move forward. So we can actually skip the next slide, and just getting into, the good news is that health authorities are really starting to take a number of actions to prepare for climate change impacts on health. And there are a number of examples that I'll provide and that we can be sharing information about and learning from. But we do have growing awareness and concern about impacts on Canadians. And so people will be aware that there are a number of health organizations and associations that are raising this awareness and advocating for action in terms of the Canadian Medical Association and the Canadian Association of Physicians for the Environment. We also know that Canadians are quite concerned about the health impacts of climate change. A survey that we did a few years ago indicated that 93% of Canadians believe climate change is having an impact on their health now or will in the future, and 55% feel personally vulnerable. And so that's something that we need to address these health risks. And a number of municipalities we know have declared climate emergency. So certainly this is an issue of top of mind. It's something that there's growing concern about. So on the next slide, given the risks that are increasing and some of the possible quite severe impacts, we need to remind ourselves, I think, that we actually have been very successful, the health community, in protecting health, in improving health. This is actually a global snapshot, and it shows life expectancy at birth from 1980 to 2010. And you'll see that, for a number of countries, there have been dramatic gains in life expectancy in terms of 15, 16, 17 years over that time, and we know that death rates in children under 5 years have decreased very significantly. The number of people living in extreme poverty is decreases. So there's still a lot of issues to be addressed, equity issues to be addressed, but we really do know how to protect health and have been successful in terms of that over the last few decades. And the next slide just provides some specific examples of this. And some of the examples here can be climate related. So, we have reduced, again, over the last number of decades, natural disaster deaths, lightning strike deaths, even motor vehicle accident deaths and occupational accident deaths. So again, we have the tools, we have the knowledge to be able to do this. And in fact, globally, there's actually a downward trend in terms of deaths due to natural disasters. And in 2018, there were 10,400 deaths, which is significantly below the average of about 53,000 deaths over the last 30 years. So that's all really great news. That's great progress that we can and should try and build on as we tackle the climate change challenge. And so the next slide just shows this is a survey that the University of Waterloo, their research center, did just about a year ago of health authorities in Canada, and there are a number of activities underway. So about 35% of health authorities actually reported that they have done some type of climate change and health assessment. A number, almost 1 in 5, reported that they've looked at actual health facilities, the resiliency of health facilities. Over half are reaching out to stakeholders in terms of education materials, and just under half are reaching out to the public. So, there's more and more activity to prepare Canadians, to prepare health systems for climate change, and so that's something we need to again build on. And the next slide just provides some examples of the kinds of health adaptations that we're learning more about, and that our office is actually working with some partners on. And so, for example, Hamilton, they've got some activities to educate landlords about protecting people at higher risk in apartments from extreme heat events. There are some health facilities in Canada that are starting to do resiliency assessments. The Canadian Coalition for Green Healthcare is a tool that can be used to do that. So I think this is a photograph of Nanaimo General Regional Hospital. There have been some projects looking at food security and growing food in northern communities. We actually, our heat division, developed a carrot rewards app to increase heat adaptation, health adaptation from individuals. And so these are really important and useful adaptation initiatives that are starting to look at how best can we reduce risk from climate change impacts. One of the areas that we need a bit more work on is looking at the effectiveness of adaptations. And I know that our colleagues in Quebec have done a fair amount of work on this. And there's actually going to be a presentation from colleagues at the Public Health Agency of Canada. Dr. Pierre Gosselin from ENSPQ, I understand, next week is going to be presenting on climate change and health and sharing a bit of information about that. So that may be of interest to people because they've been doing some really very interesting work in that area. And so just on the next slide, we're also learning more about how health system adaptation can actually save money and protect people, and getting more examples. And this can be useful for planning, I think, among health authorities in Canada. So the Gunderson Health System in the U.S., they undertook an energy transformation initiative from 2008 to 2016. And they were able to significantly reduce carbon dioxide emissions, also particulate matter emissions and mercury emissions, and keep their costs fairly low in terms of they didn't go higher than the 2008 level. So in some sense they actually were reduced. So some a real achievement there in terms of that. And also there have been some interesting planning and scenarios about health systems in terms of what would be the benefits of adapting and taking some of these measures. And there's a publication by Healthcare Without Harm that provides some of this evidence about some of the savings that can be had from preparing infrastructures in health facilities for extreme events. And so we can really learn from some of that information in terms of making the case for undertaking these adaptations. So the last part of the presentation, chat a little bit about some of the activities at Health Canada, including our national health assessment that we're doing with a number of partners across Canada, and our HealthADAPT initiative. So we'll go to the slide in terms of the Lancet Commission highlighting that climate change could actually be a great global health opportunity for this century. And they've really highlighted this because if we design our greenhouse gas mitigation measures appropriately, if we design our adaptation measures and we work with partners outside of the health sector, then we can actually significantly improve health in many areas in terms of things like developing bike paths that improve cardiovascular and respiratory health. So, there's very significant health gains to be made in terms of how we plan forward, again, for tackling climate change. And we need to keep that in mind moving forward. So a real foundation for our efforts at Health Canada on the next slide is the Pan-Canadian Framework on Clean Growth and Climate Change. So there's obviously a lot in the Pan-Canadian Framework, but there is a section on adaptation, and within that we're really happy that there's a section on protecting and improving human health and well-being that has a number of different areas in terms of addressing climate change related health risks, extreme heat, infectious diseases, key adaptation investments, surveillance and monitoring, risk assessments, these kinds of things. but also, and quite importantly, supporting healthy Indigenous communities. And so, again, this is a key reference point and a document for us moving forward with a range of partners. So the next slide is really a snapshot of what federal health partners are doing on climate change. So at Health Canada, where I'm located, we have a heat division that's helping communities in Canada expand heat alert response systems where they're needed, but also do the health promotion and communicate to Canadians in the most effective way. We have colleagues that are developing a national monitoring and surveillance approach or strategy with, again, a wide range of partners so that we get better information about climate change impacts on health. For example, the mental health impacts of a flood so that we can inform effective adaptations. And then I'll speak about some of our other activities at Health Canada shortly. But our partners in Indigenous Services Canada, they have a program where they're supporting research and adaptation development in northern communities and Indigenous communities, but also, and this is new as of a few years ago, in southern communities, which is really exciting because there were knowledge gaps in terms of that, and so that's a program running now. I think I've mentioned some of the work at Public Health Agency of Canada. Colleagues are really looking at infectious diseases, waterborne and zoonotic diseases, and doing research and surveillance and lab diagnostics there, and also the Canadian Institutes for Health Research. They're focusing presently on food security in the north and Lyme disease. So there's a wide range of partners at the federal level investing in this area and working with other colleagues on this. So the next slide, I thought to provide, this is actually a bit of a sneak peek in terms of a framework that we're developing to help guide health adaptation by health authorities. And this is really based on sort of the stages of health adaptation and then situating, the vulnerability assessment and adaptation assessment process within that. And so, from the literature, there are really 6 stages of health adaptation in terms of raising awareness of climate change risk to health and the need to adapt. And people will be familiar, I think, with some of these. Partnering with folks to be able to undertake actions, so sort of raising that awareness among partners, but also then starting sort of the groundwork kinds of adaptation measures, building the capacity to adapt, sort of stage 3, where you're identifying best practices, undertaking, adaptation assessment guidance, doing that networking and information gathering, perhaps doing a vulnerability and adaptation assessment and doing climate change and health research. And then once you have a lot of that information, once you have that network and you've, people have bought in that this is really important, you get to the area of actually implementing concrete actions. And there are a number of examples of those in terms of new or upgraded infrastructure and technology, communication campaigns, health workforce training, climate-informed health programs, and Indigenous health systems and communities and working in those areas. And that often and should include both health sector partners, but also partners outside of the health sector. And then certainly because climate is continuing to change, because the impacts are increasing, we do need to be doing this in an iterative way and evaluating our progress or things that we might need to change. And so, all of this is really grounded in the information that you get from vulnerability and adaptation assessments, and informed by that. So I'm very interested, because this is a draft, to receive feedback on that. My colleague and I, Patty Enright, are further developing this, and so I'd be really keen to hear about that. And so then on the next slide, I just wanted to highlight we do have new science and new research projects to support adaptation. There are a number, I think, of these across Canada at different levels. I just thought I'd highlight a few that might be of interest to people. That our office is involved in. One is on climate change, food insecurity, and human health, and looking at a framework around how those are linked, and what are some of the adaptation options that come out of that. How do we adapt mental health programs to climate change? What does it actually mean to adapt a mental health program or to change it? And what's the criteria that one would use? What's the effectiveness of syndromic surveillance systems and these kinds of monitoring tools? What are some new technologies to support health adaptation? What are some indicators of vulnerability to the health impacts of flooding? But also to drought. We just recently published a paper on that health authorities can use when planning adaptation. And what are some of the key factors that influence the psychosocial health impacts of climate change? A colleague that's actually leading the mental health chapter of the national assessment just published a paper on that. This is a figure from the paper that highlights a number of influencing factors that we see from the scientific literature that again can really help health authorities in terms of responding to major hazards that impact health moving forward. So again, things like social capital, cultural relevancy, access to health. Mental health care training. There are a number of factors that are important in that regard, and I've got the link there to that paper. So then, in terms of the assessment, the next slide for our national assessment, if you have not looked at it yet, the World Health Organization Operational Framework on Building Health, Climate Resilient Health Systems is really a great document. This figure is from that document, and what they do is they highlight the 10 or so key dimensions of health systems that they think could be sensitive to climate change impacts, and that we need to likely improve or strengthen moving forward. And I just highlighting that one of them is new information, getting new information from doing vulnerability and adaptation assessments. But that's a very helpful document if you have not looked at that. So next, in terms of the next slide, what kinds of information are we hoping to get from the next National Climate Change and Health Assessment? If you're not aware, we have completed, I think, 4 of them over the last 20 years in Canada. The most recent one was in 2014. We had a health chapter as part of the NRCan broad report, and in 2008 we did a comprehensive assessment. And so we'll be, looking at who will be affected as the climate continues to change, what climate hazards will endanger health, where will the risk be the greatest, and when will health be impacted, as much as one can look at this in terms of some of the data that's available. So this is what these assessments can help with. On the next slide, a real benefit of such assessments at whatever level, local to national level, is that they can help identify health programs that may be impacted by climate change, and those that could become less effective if they're not, perhaps improved or tailored, if they don't start taking climate change into consideration. So things like, seniors health program, food safety program, mental health program, travel medicine, emergency preparedness, occupational health, and so hopefully the national assessment will help in that regard, but also again assessments at other levels can identify where there may be some of these sensitivities that one might need to focus at moving forward. So on the next slide, it just provides This is actually a snapshot from the Natural Resources Canada website. They are leading the full national assessment process, and there are a number of reports associated with that. The one from Environment and Climate Change Canada was the first one to come out. And so there will be a full health assessment report that will be released in 2021. That our office is leading with a wide range of partners across Canada. I think we have now about 80 authors in total, contributing authors in total. So that's very exciting, and it's going to make the report quite robust. So you can go to the website and you can find out more about the whole national assessment process and a bit more about the health report anytime. On the next slide, we will be following, as we have in past assessments, some of the guidance that we actually helped the World Health Organization develop in 2013, looking at vulnerabilities with respect to the current burden of disease, and looking at current health protection programs, whether or not they're sufficient to deal with some of the increased risks, but also where we have projections and where we have information looking at, well, what are some of the future risks and future impacts that we might be looking at in terms of things like wildfires, air pollution in general, vector-borne diseases, these kinds of things. But also looking at adaptation and where can we identify options that will allow us to be really effective in terms of protecting Canadians. So there's quite a bit of guidance that we're following from that document, which is quite helpful. So in terms of what you can expect in the national assessment, on the next slide, I've just highlighted basically the chapters. What's new in this report that may be of interest, it will have a separate chapter on mental health and well-being, separate chapter on Indigenous populations and communities. We're really excited to have the National Collaborating Centre on Indigenous Health leading that, which is great. And a chapter on impacts on health equity in populations of concern, and also looking at the health system vulnerabilities, and how we can build resilience. So there will be new information in the report that we think is going to be helpful. So just to kind of wrap up my presentation, I wanted to mention a big initiative that we fairly recently launched. On the next slide, our HealthADAPT capacity building initiative. And this is really exciting because we're working with a number of partners across Canada to sort of collaboratively build the capacity to undertake these kinds of assessments, to gain that knowledge that we need to effectively protect Canadians, and also to adapt and to learn from each other while we're doing that, so that others can move forward as they need to. So it's really to support the health sector to prepare and adapt to the impacts of climate change. We're providing about $3 million through this initiative until March 31st, 2022. And for me, it's really quite exciting and quite interesting because we've got a wide range of different kinds of projects from across the country. So if we go to the next slide, you'll see the projects themselves. Again, they're across Canada. There are some that are looking really at doing vulnerability and adaptation assessments, sort of comprehensive assessments, for example, in New Brunswick provincially, the Wellington Dufferin Guelph Health Unit, and York Regional Public Health. Interestingly, in Northwestern Health Unit, they've actually combined a project among 7 health units in Northern Ontario, and so that's going to be quite interesting in terms of how they do that. ENSPQ in Quebec is looking from a provincial scale, but we also have projects looking at health facilities. And so, for example, Cis de Ludway is going to be looking at specifically at facilities, and that's a really important and new area of focus from a climate change and health assessment perspective. So, looking at learning a lot from that project, but also in the Northwest Territories, we'll be undertaking a full project, and then. And maybe just I've provided the next couple of slides, some quick summaries. I see that my time is going quickly. A couple of summaries. I'll let folks have a look at those themselves on the First Nations Health Authority project, which is quite focused on the impacts of climate change on marine foods and how to adapt to that. And Vancouver Coastal Health Authority is combining with a number of partners to look at climate change impacts in that area, and that's going to be very, very helpful for a number of health authorities across Canada. So we're really quite excited about those. We're developing a community of practice that partners that are not actually being funded can benefit from and can join, so that we can all be learning from these projects. So if you have any questions about any of the presentation or about that HealthADAPT initiative, please contact me in the last slide, or you can contact my colleague Nick Perzo at the email address at the bottom there. So with that, I will say thank you so much for the opportunity to Lydia and Tina, and see if there is any questions or discussion. Thanks so much.
Thank you, Peter. That was a great presentation, and really appreciate you taking the time out of your busy schedule to present to us today. So we'll start with questions from the room first. Do you have any questions here? Okay.
Yeah. I'm curious about how much effort was put into talking about adapting to climate change, and I would like to hear a little bit more about prevention. And I'm wondering why that's a topic that seems to be dodged and avoided to the extent that it is. For example, we wouldn't talk about the health impacts of smoking without talking about smoking cessation, not adapting to cigarette smoke. And yet I'm wondering if maybe some of the challenges, and if you can speak to this, around talking about prevention when it comes to climate change, you can't get into that topic without getting political. And to the extent that somebody who would advocate for a prevention program in dealing with climate change, as we do in public health, would have to talk about things that are possibly considered radical in a political realm, that you would be considered somebody dealing with an extreme, maybe left-wing view of politics or approach to politics and dealing with an issue. So I'm curious about how it is that we're approaching this public health urgent issue in a much different way than we have other public health urgent issues, where we go to the point of educating people about how to adapt their behaviors so that they're less dependent on the thing that is causing the problem. Whereas in this, we're seeming to go straight to how do we adapt to this problem rather than a prevention focus, where we're saying, how do we get off a heavily based carbon economy, and how do we adjust our thinking about how we move through the world so that we're not so dependent on that thing, whether it be cigarettes or a carbon-based economy, to start to make the changes that will get a stronger focus on prevention rather than adaptation.
Yeah, so Tina, should I get into answering questions now?
I hope so.
Yeah, no, for sure. Well, thanks a lot for the question. Yeah, so I think really talking about a kind of a primary prevention, or even primordial prevention in a sense, in terms of we absolutely need to reduce greenhouse gases, and we need to reduce them quickly. and for sure, that's a key requirement. And so one of the things, I didn't highlight this when I had the slide on the Pan-Canadian Framework on Clean Growth and Climate Change, just because we actually at Health Canada don't lead those activities, right? That's Environment and Climate Change Canada, but quite a bit of that Pan-Canadian Framework is laying out those activities that are really aimed at reducing greenhouse gas emissions. But I certainly take your point in terms of the need for prevention, the need to reduce climate change, so that we, don't have to adapt as much to impacts moving forward. I will provide, Health Canada does have a role in that sphere in the sense that, so one of the big things that we do is we provide information to our partners in other sectors at environment on the health impacts of climate change and on the, that as the climate continues to warm, that impacts increase, and this is really important. But also, we do in terms of, and these are colleagues in other programs in our AIR program, but they provide input in terms of the benefits of some of these measures in terms of measuring that for some of these regulations and things. And I guess the other link that I want to highlight in terms of the prevention that you've highlighted is, from a health systems perspective, we did help the Canadian Coalition for Green Healthcare develop the tool that some facilities are using to gauge their resiliency from health impacts. And part of that, and part of what the coalition is interested in, is promoting conservation, because that really helps for reducing greenhouse gas emissions in health facilities, but also from an adaptation and a resiliency perspective in terms of not relying on these energy sources that in disasters can be a big problem in terms of the operation of hospitals. So from a health systems perspective, there certainly is an important link there for us in terms of that kind of prevention.
Thanks, Peter. We just have we have two questions online I'd like to address. So we're going to hold off on in-room questions for now. So is Health Canada planning on assessing potential public health issues linked to post-wildfire water pollution and implications for drinking water and recreational water uses?
I'm sorry, Tina. Can you say that again?
Oh, sorry. I'll come up to the phone. Is Health Canada planning on assessing potential public health issues linked to post-wildfire water pollution and its implications for drinking water and recreational water uses? That's a great question. So for the national assessment, we do have, and perhaps people notice that, we have a separate chapter on water and water security, climate change impacts on water quality, water quantity, and water security. But we also have a chapter on natural hazards, which is going to look at wildfires. And I'm just trying to think from the last lead authors meeting whether or not there was discussion about that. I think that if there is literature that can be pulled from, scientific literature that can be pulled from that is either in Canada or relevant to Canada, that will be included in the national assessment. But I will be happy to follow up with one of the lead authors for the water chapter. Patty Enright is actually in our office. So I will be sure to follow up, and if the person that asked that question wanted to contact me directly, I'd be happy to confirm that. Okay, thank you. And other than HealthADAPT funding, are there any other grant opportunities that regional health authorities can tap into to complete the climate change vulnerability and adaptation assessment?
Ooh. Not specifically from our office right now in terms of actual funding. But one of the things that we're looking at is how best can we. So for example, we're going to be providing training and support to our funding recipients to conduct the assessments and to develop adaptation measures. And we're looking at, we are going to have a broader community of practice, and how most effectively can that information be provided to other health units across Canada and health partners across Canada. And so there's a couple things that we are developing, well, a number of things, but one is a sort of a knowledge to action user guide for doing assessments that provides case studies of assessments that have been done. I took out the slide on this, but Middlesex London has done a full assessment. Simcoe Muskoka has done a full assessment. Peel, they're actually redoing. Peel Region is actually redoing their assessment based on some latest information. So we can learn from a lot of those. In the guide, we've got data sources, different kinds of information that can be very helpful, we think. But we're also developing a bit of a workbook that goes through the different assessment steps that health authorities can use and including templates with indicators that health authorities can use to do their own assessments. So I'm not aware of funding right now from our office, but there will be these tools and these opportunities to link with a number of partners and learn from different experiences and learn about the methods and things like that.
Thanks, Peter. So do you have any questions from the room? We have time for maybe one more question.
I do, if no one else will ask it. Yeah, Peter, thank you very much for complying with my request to present. I think it speaks for the thirst for information and knowledge across Canada on this very hot topic, pun intended. I want to ask a question, and I may have to take it offline with you as well, in regards to a very practical aspect. I mean, it's great to see from the survey, the Waterloo survey, to see that local health units are really getting in there, doing adaptation work, knowledge levels raised and all that. But I think there's a fundamental question about integrating climate change adaptation efforts into daily work and priority settings. And I acknowledge that there are challenges in terms of competition of funding, competition of work priority issues. Even just take, for example, the host of health protection issues that come day to day. Of course, a number of them are related to what's happening with climate driving those changes as well. So I'm not sure if you're the one who could speak to that, but I'm sure there's audiences online now or who are able to respond or are thinking about that in terms of dealing with those challenges. So that's maybe more a point than a question for you. But here's a question: is how is evaluation being built into all these plans and the HealthADAPT effort? Like, in other words, it's great to see the resources that are going into different parts of Canada addressing very much needed topics. But at some point, and how soon might we be able to see what's working and what kind of changes in course should be taken?
Yeah, no, and I mean that's a great point about the importance of evaluation and performance monitoring, and we've learned from our colleagues in the U.S. CDC. They have a similar program, and we've actually modeled this from their program. They started one earlier, and one of the messages that we received from them was it's really, really important to be proactive and to early on be thinking about performance and evaluation. And so my colleague in the office, Nick, is really leading this for us, and we are developing basically a baseline survey for our funding recipients to start measuring right now various aspects of their projects, so that we can go back in 4 years, and they can go back in 3 or 4 years and measure how and whether these projects have been successful, have increased resiliency, and what they've learned. Because the real purpose of this project is these are kind of pilots, right? We want to be able to come out of this to say, look, this worked, and this is a really promising way to do assessments or develop adaptation options, and maybe this part didn't work. Maybe the workbook that we're developing needs to be tweaked because it didn't help in this regard. So we're very, very conscious of the importance of doing that, and we've actually hired an expert that was part of the U.S. CDC, or at least evaluating the U.S. CDC project to help develop some of the evaluation aspect of our program. So that's a really great point, Lydia.
Yeah, thank you, Peter. And so figure that is me asking the question. So put in a plug for NCCEH, where there's the opportunity for us to assist with knowledge mobilization and transfer and knowledge translation and any bit of this exciting package of work coming up. Please, you know where to find me.
Well, that's absolutely wonderful. I really appreciate that.
Great. Thank you so much, Peter. So anybody else on the line who had questions for Peter, please email him directly. We're sorry we weren't able to get to your questions in time. And thanks.
Thank you. Thank you so much, Peter.
Thank you. Bye-bye.
Bye.